My name is Dr. Thomas Schuler. I'm chairman of the Medical and Scientific Board of the National Spine Health Foundation, and I'm here to help you understand low back pain and how to get it taken care of.
Hi, I'm Thao Allen. I'm a fellowship-trained physician assistant.
Well, I'm a spinal surgeon, and I've been doing this for 30 years, and people have these questions all the time in our practice. They come to us to say, what is my problem? Is it something scary or dangerous? And how do I get better? People are worried when they have these episodes of back pain, they start becoming more frequent. Is my life over? And the reality is, it can happen, but usually it doesn't happen when we're young. It happens as we get older, and part of it is the process of life. When we talk about a spine and where back pain comes from, it's really important to understand some anatomy. So we're going to use a model to help understand that. This is a model of the low back. This is the area that most people have pain in, down by the bottom of your spine near the pelvis. And this, at the very bottom, is what's called the sacrum, and that's part that's bound to the pelvis. And then each bone here is one of your vertebrae. It's the lumbar vertebra, the low back vertebra. But the important thing for everybody to understand is that each level of the spine consists of a bone above and a bone below, so the vertebra above, the vertebra below, the disc in between, and two joints in the back. These joints are called facet joints, and they allow for you to move. And what we can see on the model here, the spine's moving. So for a healthy spine, you need a healthy disc or a functional disc and two functioning facet joints in the back. In addition to that, you need the proper musculature and movement and using the right ergonomics. But this is critical to understand what low back pain is. So Thao sees patients alongside me all the time, and what's the most common thing people ask you about low back pain?
Where is it coming from?
And I think that's the big fear. People come in and do I have cancer? That's obviously an underlying fear that most people have, is do I have cancer? Do I have something bad? Is my life over? And I think that this is what's permeating through their mind at the time they take the initiative to set up an appointment to come and see a specialist. And I think it's important to understand that for the vast majority of people, that's not the case. In fact, the most common cause of low back pain is a restricted joint in the back. So those little facet joints in the back, some people call it facet joints, but I like to say facet, those little joints can bind up, and when they restrict, it's like somebody stabbing an ice pick in your back, and it's very, very painful. One of the other most common sources of pain is the sacroiliac joint, which is a large joint at the base of the spine between the pelvis. And what we can see is this is the low back section that we were talking about. And when people have low back pain, it's down here. And it's commonly can be a disc, as we said, the facet joints in the back, or this large joint to the side called the sacroiliac joint. And in fact, in my experience, the most common source of acute low back pain is that SI joint locking up. And when that SI joint or sacroiliac joint locks up, it causes horrible pain in the back, and it's sharp stabbing pain. And just like the facet joints, it's like somebody sticking an ice pick in, and it can be severe and it can persist. And that often comes because there's a motion problem. And the motion can be because you're walking funny because you got a cast on your foot, or you've got a limp because your knee hurts, or your hip has a little arthritis. So all of these things can affect the motion of your extremity, which stresses that joint right there, the sacroiliac joint. And by having that painful, that can be very debilitating. The good news is most of that can be treated with the proper therapy. You're doing the right physical therapy program, work on strengthening, conditioning, and that can help. The same true of the facet joints in the back. Now that's assuming that there's not some underlying arthritic problem that's making this really bad. So if something's too degenerative, a disc is too degenerative, or it's unstable, or there's scoliosis where there's a curvature of the spine, those things can also trigger this. But most people, it's just because they're not doing the right exercise, or they're doing too much of something and they may be deconditioned.
Yeah, muscle spasm in the back, sharp pain in the back or the buttock, again, can be nerve symptoms, can be disc symptoms, and can be joint symptoms. And it's up to a spinal specialist to help us understand where it's coming from.
We've presented a lot of information here that can be a little overwhelming, and what we really need people to understand is when they have low back pain, how do you start the treatment? So Thao, People come into you, they want to see you for the first time, you got low back pain. How do you start? What do you do with them, and where do you take it?
Sure. As a spinal specialist, it's important for us, and it's our responsibility to make sure that the patient doesn't have anything bad, cancer, tumor, a broken bone or inflammation. So it's important for us to do a quality physical exam and evaluate the patient, and also get updated imaging studies if they need any. That can be x-rays, and if the patient is indicated, sometimes it can be an MRI, a nerve conduction test to understand if there's any nerve damage, or special scans to rule out cancer or inflammation in the bone. And so those are really important tools that we have to help evaluate the patient. But the key things as far as for most patients to understand or address their back pain is to educate the patient in the quality non-operative treatment that they have, and that's in the physical therapy and understanding the importance of core strengthening and joint mobilization, and also an aerobic exercise program to understand the importance of fitness to offload the stress on their back and on their discs.
Yeah. No, I think it's critical to understand that rarely do people have cancer. So that's the exception. And most people, they just have a problem where tissues aren't moving right, or they have a little degeneration, or they're pinching a nerve. And so there are so many things we can do without surgery to get them better, and that's the good news. In fact, over 90% of the patients make marked improvement and make a recovery completely without surgery. So it's rare that people need surgery, even coming to a surgeon. So this is a surgeon's perspective, that rarely do we have to operate on people, and rarely, less than 1-2% of the time, would people have something serious such as cancer or something else that we would need to address on an emergent basis. Become part of the process. You'll never get rid of your back pain if you're not contributing to getting better. And what that means is working with a program to strengthen your muscles and to mobilize, work on flexibility, stretching, all those things to help. And that takes care of most people. The vast majority, over 50% of the people, are markedly better just because they need a little education and they need to be moving. Hot packs, ultrasound, doing passive things feels good, but it doesn't solve the problem. You need to be doing a dynamic process to get better. And that's, I think, the critical thing about quality therapy, which is the essential part of getting better. And then using anti-inflammatories, as you said, Advil, Aleve, Motrin, things like those, or a prescription strength of those, can be very beneficial if people can tolerate those to help get over the hump. Then if that doesn't work, that's where we come back and say, maybe you need an injection. And the other diagnostic tests. So we start with an x-ray, but you get an MRI so we can look inside the spine and see the nerves, see the discs, see if something's going on. EMG is something called an electromyogram, or EMG, and that's where we put little electrodes on an extremity, either on the arm or in the leg, to see if a nerve's functioning properly. And so that's something we would do down the road if we're concerned about, does somebody have a nerve that's being pinched? That sciatic nerve that we talked about earlier, is that being pinched, and is it creating a problem? Or in the neck, could it be something that's coming out pinching a nerve? And we have to find out, is it a problem at the wrist, such as carpal tunnel syndrome? That's something people often hear about, that the nerves pinched at the wrist and leading to problems coming from the spine or in the neck. And so by using these tests, we can pinpoint where the problem is, if there's a problem where somebody's losing nerve function. And these are common tests we do to understand what's going on. People have fear of the unknown, fear of what their future is. Can they get back to their lives? And it's really giving them a competent medical reassurance that this is nothing dangerous, and that with the right treatment, we should be able to get your life back. Unfortunately, that's what happens most of the time. But it's a question of having people get the right treatment, make sure they're doing the right program to get better, and then quarterbacking them through that, following them along and helping coach them so that they can overcome their problems and get their lives back. And that's what spinal specialists and spinal PAs, that's what we do.